Hello everyone and welcome back to our channel. I'm gonna get right into it, and today I'm gonna be talking about how we ended up getting Prince's diagnosis for hip dysplasia. If you're new to the channel, this video is the third video that is part of a series I am putting out regarding our experience with canine hip dysplasia. So if you don't already know, we have an Australian Shepherd Border Collie mix named Prince, and he was diagnosed with hip dysplasia when he was about a year old, and then he underwent a total hip replacement the following year to help remedy that hip dysplasia. And essentially I wanted to make this series for anyone that might be going through the same thing, to provide as much information as I can for you so that you're not going into it completely blind, and for anyone that may be looking for somebody else's experience to draw from. So let's get into it. So to start, I'm going to be talking about what hip dysplasia really is. You may or may not know that the hip joint is actually comprised of a ball and a socket. So essentially it's called a ball and socket joint. The ball is the head of the femur, which is the bone that basically connects the leg to the rest of your body. And that the rest of your body is the socket, which is your pelvic bone. And essentially, the ball is supposed to fit perfectly into that socket. So you can see in this x-ray here, this x-ray is of a normal dog that has really good hips. Here is the ball that I'm referring to, and here is the socket. So hip dysplasia happens when the ball does not fit properly into the socket. Typically, we should see that right here, the socket should wrap very nicely around the ball to keep it secure, to keep the hip joint from being loose, from moving around, just keeping everything secure how it's supposed to be. And what we see typically in hip dysplasia is when that is not the case, when the socket doesn't quite wrap as well around the ball part of the joint. And I'm gonna put two x-rays side by side here. So to the left is the x-ray of a normal dog, and to the right is Prince's x-ray. And if you look closely at the socket, you can see it doesn't quite fit around the head of the femur as well as it does in a normal dog. And this is basically what confirmed Prince's diagnosis of hip dysplasia for us. So as I had mentioned in the summary video, which I'm going to link up here, the most conclusive way to get a diagnosis for hip dysplasia is via an x-ray. So if you suspect that your pup may have hip dysplasia and you want to kind of get a diagnosis for it to move forward, consider treatment, things like that, you should definitely get an x-ray. Obviously, in Prince's case, we did end up getting an x-ray, and Prince did have to be sedated for those x-rays. So depending on how calm your dog is, how well they like kind of being handled, you may or may not need to get a sedated x-ray, but that would be up to your vet to decide. So once we got the x-rays done, the vet looked at them immediately and she was able to tell, yes, your dog does have hip dysplasia. He does not have the greatest hips. She kind of told us exactly what I had just mentioned about the ball and the socket and how it wasn't quite wrapping around the head of the femur as well as we would like to see. And after that appointment, we were obviously quite upset and disappointed. We kind of had a feeling that this was coming, and we knew that Prince was very likely to have hip dysplasia, but at the end of the day, it was still quite disappointing and disheartening to hear. And we kind of just took the day and processed everything that the vet had said to us, and she did refer us to an orthopedic surgeon to discuss our options, because we had already done some preliminary research and we were already leaning towards getting Prince a total hip replacement. But obviously we wanted to do additional research, and obviously we wanted to speak to the orthopedic surgeon about it. So we ended up getting a consult, and we were going to just go from there. In the meantime, until we could book a consult, until they reached out to us to book a consult, we did some more research and we considered our options. And while waiting for everything, we had to figure out how to manage Prince's pain in the meantime and also maintain his active lifestyle. So at first, we definitely tried to take it easy. We considered not exercising him in the same ways that we were used to exercising him. So obviously we had to try and get rid of certain activities that required a lot of running on his part. So we did have to kind of get rid of fetch, and our sort of runs with him had to consider not going hiking as much. And so that first week after his diagnosis, we tried to figure out ways that we could get him enriched at home without any extremely active activities. But being used to his ways and being the dog that he was, he definitely did not appreciate that. So we noticed that he wasn't really responding to any of the at-home exercises that we tried to get him to partake in. For example, I tried a lot of things with his food. So freezing his food to get him to eat it slower. I tried, like I mentioned, hiding pieces of kibble or treats around the house and getting him to find them. Using things like lick mats to get him to eat his food. Wrapping his kibble in a towel to get him to kind of, use it as a puzzle where he had to unwrap the towel to get more kibble. And Prince didn't respond to any of it. So either one of the two things would happen. So either he would completely lose interest and kind of sniff for kibble and figure out, okay, I don't really want to work for my food, because he just wasn't used to that ever, and give up. Or he would just figure out the activity too quickly or get through it really quickly. For example, the lick mats, it would take him maybe 2 or 3 minutes to get to that, even if it was frozen, and then he'd just be done. And that was all it took. And obviously that was not enough to get him enriched, get him tired, anything like that. He was whining a lot, he was barking a lot, he was getting really frustrated with us, and just was so hard for him to settle down. He had such a hard time maintaining a down stay during that week that we tried all these different types of activities at home, and essentially he was just getting very pent up. None of the activities at home were really enriching him, they weren't getting him tired. He obviously is a very high energy dog, and he didn't have a channel to release any of that energy. At that point, we decided to consult the vet again. We told her what was going on at home. We tried different activities to get him enriched at home that wouldn't require so much of running. And she just told us, okay, that's fine. If he's not responding to any of those activities, you still have to, meet his exercise goals and make sure that he is getting what he needs. And if we need to figure something out in order to do that, we will do that. And so she suggested giving him meloxicam, otherwise known as Medicam, to manage his pain. And she said if you need to go on hikes and stuff, that's totally fine. There's not really anything that should be holding you back from doing any of the activities that he is used to. All we need to do is just figure out a way to manage his pain. And so she told us, before and after you decide you're going hiking or running, just give him his dose of meloxicam, and that should help manage his pain, and you should still be able to kind of continue the lifestyle that he is used to without, making him adjust to something that he's not very happy with. And once we tried that, we obviously resumed our regularly scheduled programming, and we brought back running, we brought back fetch, we brought back hiking. And Prince was obviously much more enriched, much happier. He was getting tired and feeling a lot more fulfilled, and wasn't bouncing off the walls and barking and whining and getting frustrated anymore. So that was what we decided to stick to, at least until we could decide and figure out what to do about his hip dysplasia. This particular scenario was also very helpful in our research of treatment options, because the one thing it confirmed to us was that, sedentary activities or living a sedentary lifestyle was not what Prince would like. It was definitely not what would be the best for him. Considering he is a high energy dog, obviously this was something that was bound to happen, and he, was very used to getting the level of exercise that we had gotten him used to. And so we needed to make sure that we got him to as close as 100% recovery as possible. And we knew that we didn't want him to spend the next 17 years of his life either in pain because we had to just keep managing it, or not being able to do the activities that he obviously loves very much and that satisfy his energy levels. Especially considering that we noticed that in the time leading up to his surgery, he obviously got a lot worse. His pain was a lot worse, and just giving him the meloxicam and Medicam didn't quite help as much anymore, especially at the dosage that he was previously at. He definitely, had a lot more pain than what the medication could alleviate, and so we knew that we had to do something a little bit more permanent and something that would obviously allow him a lot more time to be able to do the activities he was used to. And that is all I'm going to cover in today's video. The next video in the series, obviously, as you could tell, is going to cover what we found in our research of treatment options for hip dysplasia. Of course, this is not a condition that has a cure. It's not something that can be reversed, so it's mostly just about managing it. And so we had to look into whatever options were available to us, consider, Prince and what his lifestyle is like, and finding the best option that would suit him and us. And we basically consider those options in the next video. If you missed the first 2 videos in the series, I will link them at the end of this video if you're interested in learning more about our experience with canine hip dysplasia. If you enjoyed this video, please consider giving it a like and click on that subscribe button so you don't miss anything else. And if you don't want to miss the next video in the series, click on that notification bell. If you have any questions about canine hip dysplasia, about our experience with Prince, please leave them in the comments below and I will definitely do my best to address them. Or if you just want to share your experience with canine hip dysplasia and what you went through with your dog, please share that in the comments as well, because I'd love to hear it. And I will see you guys in the next one. Take care.